Hello guys, I am Dr. Khan and today we are going to discuss about the respiratory systems, the organs of the respiratory system and the function of the respiratory systems. So first we will start from the nose. The nose consists of the external nose and the nasal cavity, both of which are divided by a septum into the right and left halves. Okay. So now the nasal cavity. The nasal cavity extends from the nostrils in front of the posterior nasal aperture. The nasal cavity is lined by a mucous membrane, and the mucous membrane has coarse hairs, and the mucous membrane contains the nerve ending which is sensitive to the reception of the smell. Now the function of the nasal cavity. So as I told you, the nasal cavity consists of hair and mucous membranes. Okay. The hair of the nose prohibit the dust particle from the air, and the mucous membrane trap the foreign particle and organism in the inspired air, which are then swallowed and destroyed by the gastric acid. So now the next one organ of the respiratory system is pharynx. The pharynx located behind the nasal cavity and above the larynx. The pharynx further divide in three parts: the oropharynx, the nasopharynx and the laryngopharynx. Function of the pharynx. So in the swallowing process, pharynx service is a pathway for the movement of the food from the mouth to the esophagus. Now the next one organ of the respiratory systems is the epiglottis. The epiglottis is a leaf-like structure located at the top of the larynx and behind the tongue. Function of the epiglottis. So as I told you, epiglottis is a leaf-like structure that does not allow the food to inhale, okay, and also does not allow the air to digest. Now the next organ of the respiratory system is the larynx. The larynx located below the tongue and hide bone and between the great blood vessels of the neck and lie at the level of the fourth, fifth and sixth cervical vertebrae. Function of the larynx. The main function of the larynx is the voice production. Now the next one organ of the respiratory system is the trachea. The trachea is a mobile, cartilaginous and membranous tube. Its begin is a continuation of the larynx at the lower border of the coracoid cartilage at the level of sixth cervical vertebra. The trachea ends at the cornea by dividing into the right and left main bronchi at the level of the sternal angle opposite the disc between the fourth and fifth thoracic vertebra. Function of the trachea. So trachea is the main pathway for the inhalation and exhalation. Now the next one organ are the lungs. The trachea split to the two lungs, the right lungs and the left lungs. The right lungs have three lobes. The upper lobes are the superior lobe, the middle lobe and the lower lobe are the inferior lobe. The right lung is slightly larger than the left lung and is divided by the oblique and horizontal pressure, and the left lung is divided by a similar oblique pressure into two lobes, the upper lobe or the superior lobe and the lower lobe or the inferior lobe. There is no horizontal pressure in the left lung. The bronchi. The trachea bifurcate behind the arch of the aorta and to the right and left bronchi. Okay. The bronchi dividing to several million terminal of the bronchiole, and the bronchiole divides into 2 to 11 alveolar ducts that enter to the alveolar sac. The alveoli arise from the wall of the sac as a diverticola. Now, function of the alveoli or the air sac. So, the gases exchange occur in alveoli. During the gases exchange, carbon dioxide excrete while oxygen inhale or go inside the body. So, respiratory system is the process by which oxygen is taken in and carbon dioxide is given out. The process in which oxygen is taken in is known inhalation, while the process in which the carbon dioxide given out is known exhalation.